In the thick of summer, when it's rare, doctors are seeing more sick kids with upper respiratory illnesses.
WDRB's Lexi Ratterman explains the specific illnesses they're seeing and why doctors say it's happening. Lexi?
Doctors here at Norton Children's Hospital say they're seeing more and more kids come through their doors sick this summer. And like you said, it is rare for this time of the year to see things like RSV, hand, foot, and mouth disease, and croup. But doctors across the U.S. say they're seeing a rise in illnesses in infants and toddlers who are at higher risk for getting the illness. The CDC says RSV infections typically happen fall, winter, and early spring. But across Norton Children's offices, they're seeing about a dozen cases a week in the middle of summer. This graph from the CDC shows the average of RSV cases in Kentucky from July last year to this time now. You can see where the cases start to skyrocket in March. One Norton pediatrician thinks the pandemic lifestyle is definitely playing a role in the uptick.
I think a lot of families spent more time at home and weren't in social settings as much in the last year versus the last few months. So there had been less virus transmission for that reason, as well as the caution that we had with wearing masks in the last year compared to this year.
Dr. Hal Berg, who you just heard from, says the best way to avoid or detect these illnesses is to practice proper hygiene at home with the kids. Don't send kids to daycare or school sick. Keep an eye on their eating habits and keep them well hydrated and make sure they're getting plenty of sleep. Dr. Hal Berg says that if you think that your child is sick or if you notice some irregular breathing or a fever, that's when you need to take them to see a doctor. Reporting live, Lexi Ratterman, WDRB News.